Welcome to Michigan Medicine. We're pleased you have chosen us for your care. My name is Doug Ehrenberg, and I'm a pulmonary doctor and a professor of medicine in the medical procedure unit. The purpose of this video is to provide information about the procedure that you'll have today. We will also cover the benefits, the potential risks, and the alternatives to the procedure. Your doctor will answer any questions you may have after this video. The procedure you'll have today is called a bronchoscopy. Bronchoscopy enables your doctors to diagnose and treat many conditions that affect the lungs. During a bronchoscopy, your doctor will pass a long, narrow, and flexible device called a bronchoscope into the lungs. The bronchoscope has a light and a camera that allows your doctor to look inside your lungs and examine your airways. The bronchoscope will be passed either through your mouth, through your nose, or through a breathing tube inserted into your lungs before the procedure. While bronchoscopy allows your doctor to see inside your airways, the entire lung can't be seen or even reached with the camera. All bronchoscopes allow instruments like a needle or forceps to pass through the scope into the lungs to take small samples of tissue, called a biopsy, or to wash fluid in the lung and then collect it and send it for analysis. Biopsies are needed to help diagnose conditions such as interstitial lung disease, sarcoidosis, some types of infections, and cancer. Other instruments might include various types of dilators for treating narrowing or ablation devices for treating bleeding, removing tumor blockages, or abnormal tissue. Some bronchoscopes have ultrasound that allow the doctors to see through the walls of the airway. This allows the doctors to inspect and take a biopsy of lymph nodes if needed, using a needle passed through the bronchoscope. Now, I'd like to discuss the benefits and risks of this procedure with you. I'll start with the benefits. A bronchoscopy allows the doctor to see inside parts of the lung to diagnose or treat many conditions. These include certain types of infections, cancer, sarcoidosis, which is an immune system that attacks the lungs and other organs, hypersensitivity pneumonitis, which is an allergic reaction causing inflammation of lung tissue, some types of autoimmune disease that affect the lung, bleeding, also called pulmonary hemorrhage. It can be used to retrieve foreign objects, or placing valves for certain conditions like emphysema or pneumothorax. Or lastly, applying heat energy to the airways to treat very severe asthma. It's important that you also know and understand the risks of the procedure. Bronchoscopy is considered a very safe procedure. The risks from a bronchoscopy are low, but they may include a reaction to the sedation medication, including breathing or heart difficulties, bleeding severe enough to require a hospital stay, which can occur in less than 1 out of 3,000 patients, a punctured lung causing the lung to collapse, and we call this a pneumothorax. This can affect between 1 to 5 out of 100 patients, depending on the type of procedure. This pneumothorax often has no symptoms and will typically heal on its own. In a small percentage of people, it may cause some chest pain or breathing difficulty, and this might require a hospital stay. If a pneumothorax happens, a tube may have to be inserted into the chest to help re-expand the lung. An infection, which occurs in less than 1 out of every 2,000 patients, and very rarely, a blood transfusion or surgery are needed to treat these conditions. Risks are higher in people who are taking blood thinners or in people that have severe underlying lung disease requiring them to use oxygen. Now let's talk about the alternatives to bronchoscopy. The alternatives include surgery, which is a more invasive approach, or taking a biopsy through the skin, guided by a CT scan, which has a higher risk of lung collapse. While imaging tests like X-rays or CT scans can be helpful in identifying problems in the lung, often bronchoscopy is required to provide your doctor with additional information they may need to choose the right treatment. Thank you for reviewing this video and understanding the risks and benefits of a bronchoscopy. Your doctor can answer any additional questions you may have. And thank you again for receiving your care at Michigan Medicine.